Welcome to my YouTube channel, a channel where you will learn medicine, health-related conditions and diseases, what causes them, how can you prevent them, how can you treat them, and most importantly, how can you deal with them at the convenience of your home. At this channel, you will also learn danger signs of the most common diseases and conditions and how you can deal with those diseases. We teach you how to notice those signs because they can always be an indicator of a bigger problem than you can actually anticipate, and always seek for medical advice or a medical help in case you notice any of the signs that we always tell you about on this channel. And today we are looking at period signs that you should never ignore. These are the signs, if you ever notice them, then you should probably seek for a medical help or do more investigations to be able to notice what exactly is the cause of these signs. And the first one is bleeding after sex. In medicine, we call that postcoital bleeding. Now, bleeding after sex can be as a result of many things. It can be because of friction during sex. It can be because there is an infection. It can also be due to an inflammation of the cervix, or what we call cervicitis. But also you need to note that it can actually be as a result of a serious problem like cancer of the cervix. And therefore, that's why we advise that if you notice that you always bleed after sex, then you need to get medical attention so as they can be able to rule out the cause of the problem. Secondly is what we call intermenstrual bleeding, or bleeding between your periods. What do I mean? In this case, this is where you find, for example, you have gone into your periods on the first day of September and you are expecting to go again into your periods on 30th of September. But again, in between around 15th, 16th, or any other day in between, you experience a lighter bleeding. Most of the time it is always lighter than the real periods. So when it starts to become common and it is happening more often, then it could probably be telling that there is another cause. Probably it can be because of the family planning you're using, or it can actually mean that there is a fibroid. A fibroid is a mass that is always embedded in the walls of the uterus. So it can bring about that bleeding between your periods. Another sign to look out for is if there is a change in the flow, and specifically when it becomes heavy. Now, the issue here is, how are you going to note that it is becoming heavy? One of the ways how you can note that is when you start to increase the number of tampons or the number of pads that you use during periods. If you've been using, for example, 2 pads, now you find yourself you are using 3, 4, 5 pads in 24 hours, then it means it is becoming heavy. And it can also be an indicator that you actually could be having other serious conditions like fibroids, like infections, and other problems. Another sign is bleeding in menopause, or what we call postmenopausal bleeding. Now, this is a red flag. In other words, what I mean, it is not common to find someone who had gone into menopause to start bleeding. If that happens, then it can actually mean there is a serious problem. And most of the times, this is one of the signs of cervical cancer. To expand a little bit more on bleeding in menopause, ladies have an age where they reach and periods or menstruation completely stops. Some reach at that age at 60 years, others 65 years, depending. Now, when you have already gone into that stage, when your periods had completely stopped, and then now after a year or two, they again reappear, the bleeding reappears, it is a sign that you need to be on the lookout and take note of it and seek for medical guidance. Another sign is extreme period pains, the dysmenorrhea, but when it becomes so much intense. Now, I know we've talked about this in one of my videos, how to control the pain and how to deal with the pain during periods. But in cases where it becomes very severe, in that it interrupts your daily routine of activities, then it could actually be a danger sign. It could mean that you have other conditions like what we call endometriosis, what we call adenomyosis, and other conditions. So when the pain becomes so much severe that you can't really do your activities with the pain, then it could mean that you need to seek for medical help so that they can examine you very well and know what could be the problem. And then there is change in menstruation. Now, the change can take different directions. One, it could become longer. In other words, the cycle, if your cycle was taking 28 days, it could become longer, 35 days, 38 days, 30 days. So you notice that your cycle is becoming longer. Or it could become irregular. This month you have a cycle of 21 days, the next month you have a cycle of 25, the next month you have a cycle of 30 days. So it is becoming irregular. Or you find that it is becoming longer in days that you take when you're in your periods. For example, averagely should be 3 days to 5, and you find now it is taking 7 days, it is taking 10 days. So that change in menstruation is what we are talking about. This change can be as a result of many things. It can be stress, it can be exercises. A lot of exercises can also cause that. It can be due to maybe you are using a hormonal family planning method. But if all of those are actually not the causes of the change in that menstruation, then you need to actually find out what the cause is, because it could mean that you have issues with your thyroid hormones. When you go to health workers, they will investigate and be able to notice where the problem is. And lastly, missed periods. Now, I know when ladies miss their periods, the first thing to come in the mind is, am I pregnant? And true, the most common cause of missed periods is always pregnancy. But if you rule out the pregnancy, and probably you are not using any hormonal method of family planning, then it could tell you that you need to understand why there is the missed period, why you have not experienced your periods. Now, those are the 7 signs that you need to be on the lookout and be able to seek for medical guidance and medical help in case you notice those signs. And please do not leave our channel before you subscribe down below and hit the notification bell so as you always get the update of every information that we always upload on our channel. Thank you so much for watching.